Hi, so I've had a few people message me here, email me here recently, asking how things are going as far as my surgery, and I really appreciate those kind inquiries and comments, and I'll give you an update. I am at 4 months now post-surge, and things are really going pretty well. I do have some good days. I have some days that are less good. It's been a while since I had a bad day for pain and swelling. It's probably been a couple of weeks now, but I'm still and will continue to wear this ankle brace for probably at least another 6 months. This is really, it looks like a kind of big, bulky, chunky brace, but it's most of the time I don't even know it's there unless I like look down and see these, this plastic, these lateral straps, this lateral stirrup type thing with the straps, and all it really does is keep the ankle from rolling, because that's what I don't want to happen. So I've actually never kind of been a fan of these bilateral support braces, but they are good, I think, for like a situation, post-surge situation like mine. I do have my foot and my ankle wrapped right now because they are kind of swollen, and that's always a good thing to do if you got a swollen foot. And I'm still wearing this post-op shoe because I'm still having the numbness is gone, but I've still got some pain and some irritation, mild, and a little bit of swelling in my fifth metatarsal, my fifth toe, which has kind of been bothering me since my last cast came off. So all these little things can happen after a surgery. Whenever you have a surgery that takes, like, let's say an hour or more, that's a significant surgery. Going under general anesthesia, that's a significant surgery for most people. And there's always a period of recovery, however, short or long it may be. But if you have something like what I did, it was not like, open heart surgery. Then again, a lot of heart surgery nowadays, I think is not even so open of the heart. They use robotics and stuff. And I don't think my surgeon used robotics for my surgery, or if he did, maybe I wasn't really aware of it, but he's been doing these procedures for like more than 30 years and is an expert, needless to say, at doing them. But other than that, things are going well. I've not seen my doctor in about a month now, and the last time I went there, he said, yeah, your ankle ligaments are good and tight, not like uncomfortably tight. I mean, I don't feel it, but like just a physical exam of the ankle, and kind of moving it around and flexing it and doing some like sometimes in a physical exam, that's just what they do. Like they have you do counter pressure, like they'll like push on it, push on your hands or push on your foot or something like that, and you're supposed to push back. So he could tell that my ankle ligaments are good and tight, and that the operation was definitely a success. So I'm not really back. In fact, I'm not at all back. There's no really about it. I'm not back as far as being back up to speed with my physical activities outdoors. The most I've walked since I had the surgery was like 2.5 miles, and I think there was a day where I kind of tried to push it up, and I think I did like almost 4 miles one day, but that really was not good. But that was really the one day I did it. But other than that, I haven't gone like more than roughly 5,000 steps, which is roughly 2.5 miles. So I'm at the point now where I can probably think about getting back up, starting like what I did that one day with like 3 to 4 miles, doing that more regularly now, because I think I'm at that point. But as I say, I'm not real my foot as a whole is just not really comfortable yet. Like wearing shoes on both feet, it's going to take a while before that really gets to the point where I can do it comfortably. So I can, as I say, I can do it like for 2.5 miles, but it's like doing any more than that is going to take just a little bit more effort. But I guess I'm probably at the point now where I can start that effort to get back to that point. But I haven't been on crutches for almost 2 months now. The last weekend I spent on them, I went to a wedding out of town, and I was in the boot, and I knew I was going to be walking a lot, so I used them all weekend. And that was really the last time I used them. And then my boot came off a couple weeks after that. So So I think things are really pretty good now. I still have my handicap parking permit until March. This is October. It doesn't expire until March, so that's going to continue to be good. Whenever I go someplace, I can park close to the door, provided there's all the other handicap spaces are not filled. So as I say, I have good days and I have bad days, but hopefully, you know, the problems with my left ankle are a thing of the past. Now. I've had problems with both of them over the years. I did have a fracture in this one 3 or so years ago, and that took some time to recover from. And then of course this one that's been chronically bad and that was finally fixed. So, but as I say, you know, if you have a surgery, it can take anywhere from, you know, months to a year, and 4 months out, I'd say things are pretty good. Are they 100%? No, it's probably going to take another 4 months before things are really at 100% again. But my doctor did tell me that the like mild pain and swelling in my ankle and my foot is normal for this. You know, I didn't, as I mentioned in another video, I was not told to go to physical therapy, which is a good thing, and my doctor just mentioned that the reason he doesn't send anybody to PT for this, thank God, is because PT is not that effective. The reason he doesn't is because, you know, he doesn't want the surgery to be, you know, messed up. And when you go to PT, they try to, you know, get everything unstiffened and loose again and flexible again. And that's not obviously what I want with this ankle. I don't want the ligaments to be loose again and causing, you know, this floppy, unstable, chronically unstable left ankle. I don't want that again. So I don't think physical therapy would probably be the best thing for my situation. I have talked to other people who've had this same surgery and they went to physical therapy. Different doctors do different things. I'm glad it seems like my doctor has the right idea about this though. I would agree with him that physical therapy is probably not good for this. So anyway, I know in that video, I made this video when I was still in my white surgical cast, and I was talking about PT on that video and saying how much I dreaded going there, and thank God I just didn't have to go. So in the meantime, I will continue doing this, wearing this post-op shoe and this brace for like another at least 4 months, if not longer. This is actually not the brace to use if you're going out and doing significant physical activity. It's kind of like either around the house type brace, or if you're on crutches with a sprain, you might wear one of these and, you know, wrap your ankle at the same time underneath it. That's a good way to heal a sprained ankle. But if you're doing physical activity nowadays, you know, they have these really good braces, you know, athletic braces, and I've got like 2 of them. And they're, you know, lace up. They are the lace up style, like an adaptation, like a more modern version of the old style, like football player ankle braces that you just like lace up. Now they've really got them down, and they're really pretty. They're very good. They'll prevent an ankle roll, and they support from the front as well, like your talus bone and the tendons in here. Well, like even with this, I can move my foot up and down. But those, you know, it keeps your whole joint pretty well locked. So when you're doing physical activities like running, jogging, playing tennis, basketball, whatever you're doing, using both your feet, you should probably wear one of those if you have a bad ankle or if you have, you know, post-surgically. So as always, I thank you very much for your patience and for watching this. And if I do have anything, as usual, if I do have anything more interesting in the way of information to share, I will definitely do so. So have a good day.